Hello, I'm Shane Schulz, and you're listening to the WEGO Health Podcast. WEGO Health is a network of over 100,000 patient advocates, influencers, and experts helping others and transforming healthcare. The following interview is from the WEGO Health Awards Winner Series. Hey, Kristen, it's great to have you here today.
Hey, Shane, happy to be here.
It is awesome to have you here. Listen, we're going to listen to an interview that I did with a friend of mine. His name is Ronny Allan. Why don't you go ahead and tell us a little bit about him?
Yeah, Ronny, excellent man. He won our Best in Show Community Award, and his blog really discusses, the various aspects of his cancer and his own treatment for metastatic neuroendocrine cancer, and, the daily changes that he's had to make in his own life, given his condition. And he's very factual, gives education and awareness as best as he can, but he definitely has a pinch of humor, and he loves to inspire others really by putting a positive spin on his situation.
He really is pretty cool. So why don't we go ahead and listen to the interview?
Sounds great.
Oh, man, we got to get this guy. Ronny, come on over here with us. So how are you, Ronny, today?
I'm fine, Shane. I'm a bit jet-lagged from that flight over the pond to get here just in time.
For those of you who do not know who Ronny is, he's going to tell you he does not live here. He's over there across the pond, but he is here for a reason, just like every advocate that is here for the WEGO Health Awards is. Go ahead, Ronny, tell us who it is that you represent.
Okay, basically, I represent myself on social media, but I'm an advocate for a less common, unusual, not many people have heard about it, type of cancer called neuroendocrine tumors. Some people just call it neuroendocrine cancer. I advocate on an international basis because the population size is not as big as some of the other conditions out there, so we tend to join together on an international basis, and it gives us more power to our elbows. I deal with people from North America, from all over Europe, from South Africa, from Australia, New Zealand, and many, many other places. Those are the main places I've just described there. I'm actually a patient myself. I was diagnosed in 2010 with metastatic neuroendocrine tumors. Now, let me explain. The disease is one of those silent cancers where it kind of just sneaks up on you, and more than half the people who are diagnosed late. It's not, in most cases, there are aggressive types of it. In most cases, it's not that aggressive. But because it's silent, it kind of just sneaks up on you. Over the years, a lot of people have said that their physicians have told them it's probably been growing inside them for 10 years. Sometimes there are symptoms. Unfortunately, there are symptoms of day-to-day illnesses. So a lot of people get misdiagnosed. A lot of physicians don't understand that they might need to think outside the box, and they just treat the symptoms rather than the patient. I got to the stage where I said more needs to be done. I need to start doing my bit to help the other advocates, the other advocate organizations who exist in all the various different countries where this disease is prevalent. No country seems to have more than the other. There seems to be a relative rate of incidence and a relative rate of prevalence. So what I did about 2014 was to set up a blog.
Okay.
Now, I actually did it to coincide with some fundraising activities that I was doing. A lot of people do that. But I got such good feedback on the blog that I decided that I would keep going and do it as like a job. But it's become a bit more than that.
I know the feeling.
Yeah, well, you sound like a busy guy too. I decided that the feedback I got was really good, and I decided to keep doing this, and I just managed to enhance. I had some skill sets that enabled me to do this anyway. There's some gaps that I found, and one was that we needed more awareness. You will always have an awareness gap with this type of cancer, because if you don't eventually discover it, although it's not particularly aggressive in most cases, the symptoms that it gives you can be quite debilitating. Mm-hmm. Some people lead awful lives because of it. And if you don't find it and start to give it some treatment, it will kill you. And so awareness of the disease is extremely important so that we can catch, a number of reasons. One is that we can try and get people to learn about the symptoms, and they can prompt their physicians, and the physicians can maybe think about that a bit more, and they can catch that earlier. And even if by the time you catch it, you are metastatic and it's incurable, as it is in my own case, you can still get a lot lot of very good treatment for it now, and then lead a reasonable life with quite a good outlook in prognostic terms. Unfortunately, when it's not caught early enough, and even at the metastatic stage, it can just keep going and going and going. Eventually, some people can have really bad symptoms and not have particularly good quality of life and particularly good prognostic outcomes. There is an aggressive form of the disease, which is very similar to other aggressive cancers, such as pancreatic, lung, and bowel. It's an unusual cancer because it's not like those cancers I've just said, in that you can only find it in those particular parts of the anatomy. It's found in the neuroendocrine cells in the body, and those cells exist everywhere in your body. So technically, the primary tumour could be in any part of your body. And there are some highly unusual parts of the body that I've seen people diagnosed with a primary tumour. The most common locations of the body is the small intestine, which is an unusual place to get a cancer, the pancreas, the lungs, the appendix, the rectum, and a whole host of other less common locations to get the cancer. The symptoms that you can have collectively can be called syndromes, and there are a number of different syndromes depending on the location of the primary tumour. As I said earlier, the symptoms can mimic day-to-day illnesses, which makes it quite a difficult to diagnose cancer, causing it to be misdiagnosed, causing people to ignore those day-to-day symptoms, which was the case with myself. And in some cases, people's tumours are found accidentally or incidentally, to use a medical term, during checks for other conditions, and suddenly find that they've actually got this thing called neuroendocrine tumours. I eventually expanded my blog and I set up a Facebook site, which has been really successful, and it has expanded my work to no end. And that is where my main community sits. My Facebook site is a front end, if you like, for my blog site. I do post more on my Facebook site than I do in my blogs. I'm also quite big on Twitter. I actually probably spend about equal amount of time on Twitter as I do writing a blog. Twitter, I find, is a really different audience to Facebook. Facebook, you're likely to get predominantly people who have got the condition, or one of their family and friends has got the condition, or they're a caregiver, and other interested parties, medical people who want to know more about it because they've heard about it. Twitter is a completely different audience, where the minority of people who follow me are other patients and advocate organizations. There's a whole wide range of interested parties on Twitter, and it's a really powerful tool. And I get what you said earlier about it's a small amount of characters, but the content can be enhanced by the use of infographic pictures and, of course, links to blogs and Facebook posts. Facebook's pages, which are public, you can link straight into those areas as well. So it's really a good way of integrating a lot of different social media platforms and getting it to a wide spectrum of audience and bringing in new people into your community, both as patients and both as people who are interested and willing to advocate for the disease. I'm also on Pinterest, but it's a fairly low-level activity, but I'm planning to expand that, planning to join Instagram and expand that too. My main site is on WordPress, which is a fairly standard and well-known blogging tool. I've kind of got used to that, and I've upgraded the package because I got quite serious about it, hoping to provide a better service to my community and other people who read my blogs.
Well, I got to tell you, it's funny because I'm sure that the audience knows now that you are definitely capable when it comes to social media. And what was funny is while we were organizing the red carpet experience that we're doing here for all the advocates, I sent out an email, with giving some ideas of what it is that we were going to do and everything like that. And Ronny comes back and he says, I'll bring some awareness into your emails and your pages and watch this type of thing. And next thing you know, my emails just tripled within an hour. It was just whoom. And
sorry about that.
But it was in a good way. Because, you obviously are very passionate in what it is that you do. I joke about it. I joke on them all the time. but he is a very, very well authenticated guy who really cares about what it is that he does. And so I really am amazed what it is that you are doing. It's not, well, it's unique, but it's also atypical when it comes to the different diagnoses of cancer that are out there. One thing that I had mentioned in the past year and on my different shows is I dealt with a lot of doctors with my employment that I used to do and my business that I used to do. And I know that it's very common for the providers to go ahead and really treat the symptoms more so than what is the actual nucleus of the problem. Not necessarily because that's what they choose to do or they want to do, but really it's hard to find out because you had mentioned there are a lot of symptoms of what it is that you were affected by that could be for a whole lot of different
Absolutely.
issues.
And if I can expand on that, let me give you two quick stories.
Okay.
One is about me, and one is about your average neuroendocrine tumor patient. Sometimes we abbreviate that to NET. I was actually quite lucky with my diagnosis. Now, I was having vague symptoms. I was getting bouts of diarrhea, and being a man, you just think, wow, I've obviously eaten something that didn't agree with my stomach. And because it wasn't happening every day, I kind of just got more to that way of thinking and just forgot about it. And 6 months before I was diagnosed, I think it was about 6, it might have been 9, I honestly can't remember, I started getting, I'm going to let you have some of the symptoms of neuroendocrine tumors now. Mm-hmm. I was getting a facial flushing. Okay. And it was like pins and needles in my face. And it wasn't a wet flush. It was a dry flush. And it was completely bizarre. And it wasn't happening every day. It just happened every few days. But it again got more frequent, maybe a couple of times a day. And you know what? I completely ignored that. Yeah. And it wasn't until I spoke to a nurse some months later, and I didn't even mention the diarrhea or the flushing. I said to her by accident, I wasn't planning to say that to her because she asked me about any other issues, and I said, I think I'm a bit lighter than I thought I was. And you know what? She thought outside the box. She looked at my age, I looked pretty well, and she says, I'm going to give you some blood tests. And one of my blood tests gave them a clue to see a specialist. He said, this is odd, and he scanned me, boom. Tumours everywhere. Oh. Now, let me tell you, another reason why I do what I do is I joined half a dozen patient forums, and I was completely shocked by the stories that I was reading and about the effects that this had on people. Now, I have effects, but other people have them a lot worse than me. And I decided this is what made me want to do more. Now, your average neuroendocrine tumor patient has been misdiagnosed for 5, 6, 7 years with irritable bowel syndrome, with asthma, because certain variants of the tumor causes release of hormones. It's a tumor which is related, and this is where the neuroendocrine comes in. Right. It's a tumor that can release excess amounts of particular hormones depending on whereabouts it is in your body. So there's the asthma coming in due to the release of certain hormones. People have abdominal pain. If it's metastasized to the extent that it goes to your bones, you're going to get a lot more pain than other people. People have palpitations. People have blood sugar issues because one of the areas that it can affect is your pancreas. Mm-hmm. And I could go on for another half an hour telling you about all the different day-to-day symptoms that physicians see when they speak to dozens of patients every day. Right. But these patients have got neuroendocrine tumours, and every time they are sent away from a physician, these tumours, most of them growing slow, continue to grow. And by the time someone actually does something about it, it's too late. They're metastatic and they cannot be cured, and they need lots and lots of treatment. A lot of the treatment is surgery, and to add to their issues, you've then got a lot of what I call the consequences of cancer. The surgery they get takes big chunks of their body out, and these chunks of the body were there for a particular purpose. And when you take them out, your quality of life takes a hit. Yeah. So these guys have got to be treated for the rest of their lives. They've got to be under surveillance for the rest of their lives. And they've got to cope not only with the effects of the cancer, but the effects of the treatment that they're getting. A lot of them, like myself, are receiving hormone therapy through injections of a particular hormone which helps to inhibit the other hormones over-secreting. Don't want to go too technical. I like to keep it general. And this is the way I like to talk on my blog, because people love me talking in an understanding way, in a non-technical way. I'm well known for taking technical subjects and describing them in a non-technical way. And I love doing it. And I get a lot of feedback from that. And it makes me want to do more. It motivates me. And you're right. I'm very passionate about what I do.
I know you are. I know you are. So with your community, you obviously want to reach out to them. I mean, if there was a message that you wanted to be able to broadcast to your community more than anything, what would that be?
There's a number of messages to, I actually, when people contact me privately, and sometimes I let loose a blog if I'm in a particular mood, I say, it's not the end of the world. A diagnosis of neuroendocrine tumours is not good, but there's a lot of treatment out there. The awareness is getting better. There are more and more doctors coming online who know about it. There are more and more treatments coming online that are designed to help. They may not cure you, but they're going to alleviate your symptoms and keep you living longer with a better quality of life. And so I say to people through all those messages, it's not the end of the world, and we need to be a bit more positive about our condition, and that helps other people. The number of people who have contacted me to say, thank you for saying those words. I needed to hear that today. There's some of my blogs where I say, I take the I in neuroendocrine and I take the CAN in cancer, and I say I can. And you need to really say that with neuroendocrine tumors. And a lot of people, they don't feel like doing much during the day, but you've got to try your best to be active and make the most of your life. And when people contact me privately, some of them are in a bad state, and they say, I don't know how long I'm going to live, and I don't know how serious my disease is. And first of all, I tell them I'm not a doctor.
Right.
But I do read a lot, and I know I can refer them to places to look at that are text written by doctors, and then neuroendocrine tumor specialists send them off to read those particular extracts that I quite like to quote to them. That backs up what I say. And I'm also very sympathetic to people who are going through a hard time, and I find it sometimes quite difficult to know what to say to people. It's quite difficult, but I tend to find the right words, and hopefully they appreciate what I've got to say.
Well, I think they do. And, you had mentioned the I can portion of what it is that your message is to bring out. And one of the things that we do here at Arisen Strength is we do everything that we can to kick the can and to live in the can. And what that sometimes means is doing what we can when we can. That's not to mean that you can do it all the time. And that really makes a difference, because you're giving an inference to somebody who's dealing with some very tough situations. And, on Arisen Strength, we've talked about the majority of them all. To be quite frank with you, we haven't done cancer yet. The reason why is I didn't think that we were ready to, but we plan on it in 2017. But the thing is that we've talked a lot about some very tough subjects, some very tough topics and conditions. And when we sit there and we're telling people to step in your solutions, it's something as to where we're trying to get people to understand what you're going through is not who you are.
Yeah.
And to make it very clear that it's a smaller percentage of life as opposed to a consumption of life. And so trying to help people adjust their mindset when they're going through these tough times. And it sounds like that's exactly what it is that you're doing as well with your blog.
Yeah, I try to, I advertise my blog as a positive blog, knowing that people are going through a hard time. And it's sometimes quite awkward to put that over. But I try my best, and it seems to have an effect. And I get a lot, as you say, I get a lot of feedback. You mentioned about, do what you can in the time. I'm a big advocate of that. I try to delete negative words and put in a positive word. For example, I have accepted a long time ago that my disease cannot be cured, but I never ever call it terminal. I call it incurable but treatable.
Yep.
And I try to manage, adjust my what I do and how I live in my lifestyle to give me the best quality of life possible. And I've got family to keep me going, and they're a huge strength. My wife, my kids, and my grandkids. I've got 4 grandsons, and they're a huge part and what keeps me going. But I say to people, you have to keep busy and keep doing things, and it's not about how fast you do it. It's not about how high you need to climb, and it's not about how much you need to do. For me, it's direction. You need to be going forward.
Mm-hmm.
And I'm a great believer in that saying there. I know it's been said many times before in many scenarios, but I think it's a great saying that gets people thinking about what they want to do.
Well, one thing that you kind of remind me of is Ozzy Osbourne. And with the idea, he's a very blue-collar kind of guy. He's very basic. He's like, look, just keep moving forward. And that's exactly what it is that you just mentioned.
Well, let me tell you where I get that from. I spent 29 years in the military.
Okay.
So I don't give up easy. There's a mission. I'm on a mission. And by the way, my mission is to be one of the cancer guys on your show next year. How about that?
I would definitely invite you. Of course, I'll have to have security, but yeah, I'll invite you. No, you're always welcome to be on any of the shows on my network, and I very much appreciate what it is that you do and for being with us. So why don't you go ahead and tell us, where it is that we can find you and where it is that somebody who's going through, well, it doesn't necessarily have to be the unique type of cancer that we're talking about here today, any type of condition that somebody can go through. It sounds like they can benefit from going to your blog.
Absolutely. I want to widen the scope of my blog. If I can help other people, that would absolutely make me feel really happy. I've actually got quite a footprint on the internet. If you just type in my name and blog, and let me spell it for you, because like you, a lot of people misspell my name.
Yes.
I know this because I can see what people are searching for on my blog site. Yeah, my name, Ronny, Ronny.
Okay.
Yeah, and Allan is Allan. That's how you spell it in Scotland, my home country.
Okay.
And if you type in Ronny Allan blog, you will get to my blog site. My Facebook site is in the name of something called Net Cancer blog. Now, Net Cancer is just a localism in our community. That's what we call it for short. Because neuroendocrine tumours is quite a mouthful.
It is.
So we just abbreviate NET to neuroendocrine tumours, which is actually an abbreviation, and add cancer on the end. And so if you type in Net Cancer blog into Facebook, you will come up to my page and you just press that like button and you're in. And you'll see lots of interesting stuff on there, not just about my cancer, but about other stuff too.
I have no doubt. Folks, he is Ronny Allan, and he is doing some amazing work. And so definitely check out his blog, check out his Facebook. It sounds like you can see him just about anywhere on social media. So thank you so very much for being with us, and enjoy the show.
No. Thank you, Shane. Thank you for the opportunity to be here and speak to your listeners. Hopefully next week when we're walking down the red carpet, we'll see you again.
Absolutely. I appreciate that. To learn more and to join the WEGO Health Network, visit www.wegohealth.com. That's www.wegohealth.com.